Robert Murphy is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Let me ask you about something that also in the news, the teachers' strike. One of the sticking points has been this metric for closing. Is there a standard metric? Is it a gray area? What are your thoughts on that?
Well, it's a gray area, and it's a negotiation between the teachers, the community, and the school and the school board. It really just kind of depends. It uses all the common sense metrics, keeping desks apart, like in the picture here, and not having high-risk activities such as indoor sports and singing in choirs in small rooms. There's a bunch of things that you can do, and that's a negotiation. There is no standard, though.
Now hearing reports that if you have had COVID, you might only need one shot of the vaccine. True?
Well, we don't know yet, but it's suggestive. Having COVID is like having a vaccine. You've just been exposed to the virus and you've made this big immune thing. You should be different from somebody who hasn't had COVID. And they have shown that. Definitely people who've had COVID, when they get their first dose of the vaccine, they have more side effects than people that never had COVID. Now, whether that translates to better immunity, we have to see. But it's a possibility, and it's being studied very closely now because that'll save a lot of vaccines.
Some people experience little impact, but what are the studies saying about long-term impact now?
Larry, this is probably one of the most important questions of the day because it has been shown, even in people who had no symptoms to COVID, that they have abnormal lung scans. They have some of them some have abnormal heart function, and some of them have some blood vessel diseases that really can only be, or abnormalities, not diseases, that can only be identified with very intense testing. So it's not normal. This is something we don't know how this is going to play out, but 10% of those people, as we talked before, have some kind of symptom 6 months after they had the COVID.
All right, let's get to some viewer questions. Why does everyone get the same dose of the vaccine? Wouldn't a 90-pound, 85-year-old woman need less than a 35-year-old, 250-pound man?
Yeah, it may sound a little counterintuitive because a lot of drugs are actually dosed a little bit by weight, or mostly as age. But for the vaccine, the antigen, the presentation has nothing to do with bone size, muscles, or fat. It's all your immune system, and your immune system is relatively the same for most adults and older kids.
All right, here's a question. I received my first dose of the Moderna COVID vaccine, but could not get an appointment for my second dose until 38 days after the first. Is this an issue?
Good question, and it's not an issue. The only thing is that it's going to take you an extra week or two to develop the immunity because you're getting it a little late. As far as the efficacy of the second dose, it'll be fine.
All right, next question. My daughter went into anaphylactic shock after eating shellfish last year. Can she receive her vaccine at a vaccine clinic, or should she get it at a medical center? She does have her own EpiPen.
Well, it's good she carries her EpiPen, that's for sure, and she does have a higher risk of anaphylaxis to these vaccines, although it's still pretty low. There has been a report in the MMWR, this is from the publication from the Centers for Disease Control, showing that there was more anaphylaxis from the Pfizer vaccine compared to the Moderna vaccine. So if it was me, I would go then with the Moderna vaccine, but one thing, I would have it in a hospital setting.
All right, if you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Thank you, Doctor.
Have a good day.